Prior to meeting the patient in the waiting room, the therapist completes thorough hand hygiene via the use of hand sanitizer. The therapist then completes an introduction using the acronym AIDIT: Acknowledge, Introduce, Duration, Educate, and Think. The therapist starts this process by acknowledging the patient, introducing himself, and educating the patient on the expectations of today's session, and thanking the patient for completing his paperwork and acknowledging the effort that this took to complete. To ensure that the therapist has found the correct patient, he asks the patient to verify his name and date of birth before asking the patient to stand up and walk into the treatment area. As they are walking back to the table, we see the patient gait that favors his right leg. This symptom aligns well with the patient as he has had a total knee arthroplasty on the right knee only 2 days ago. The therapist also tests the patient's cognition, hearing, and ability to dual task at this time by giving instructions to walk to the last table on the right while the therapist walks behind the patient. The patient demonstrates no difficulty with this task. Once the patient is sitting, the therapist continues the AIDIT conversation by stating the expected duration of the evaluation and providing clear communication by obtaining consent for a hands-on treatment this session. At this time, the therapist will begin taking vitals, starting with putting on the oximeter and taking a manual blood pressure reading. To ensure accuracy, the patient's feet must be flat on the floor as seen here, and the oximeter must not be on the same arm as the blood pressure cuff. Next, a thermometer is used to obtain an oral temperature to help rule out any signs of an infection, and the therapist asks the patient to confirm any known infections at this time.
Do you have any infections going on? Alright. 98 oxygen, 70.
This patient presents with oxygen saturation, heart rate, blood pressure, and temperature values that are all considered to be within a healthy range.
Alright, 97.2. Very good. Alright, I'm going to check your lung sounds. Okay.
Next, lung sounds are checked bilaterally, listening at the superior, lateral, and distal portions of the lungs by using a stethoscope. The patient's breath sounds are normal with no wheezing, bronchi, or crackling noted. The therapist continues on with the subjective questioning of the patient regarding any changes in vision, taste, touch, or the possibility of numbness or tingling. The patient answers no, which helps to rule out most of the other cranial nerve tests. The therapist completes a pupillary reflex test to ensure that this myotome is intact, as it is not easy to rule out through subjective questioning.
Nothing. How about touch?
For this test, the therapist shines a pen light into each eye twice, while first looking at the same eye as the light to watch the pupillary response, and then again to watch the opposite eye as the light to watch its pupillary response. This patient demonstrates a normal response of pupil constriction when the light is presented and pupil dilation when the light is removed. The therapist then moves to screening out a deep vein thrombosis, otherwise known as a DVT, by asking the patient if he has any history of cancer or recent cancer treatment, as well as asking if he has been bedridden in the last 3 days. The therapist also completes a physical screening via palpation over the gastrocnemius muscle belly. If there is pain, it is an indication of a possible DVT. In this case, the patient is negative for this test, as he does not experience pain on palpation.
Elbow right on the side.
Next, grip strength is taken via use of a grip dynamometer. The right hand appears to be stronger than the left, but this remains in alignment as the patient is right-handed. Later, a knee extension force production test will be completed, and these values should be within a ratio of 0.7 to 0.1 to one another to demonstrate good health.
For the movement screen, I'm going to have you look up. Now look down.
Next, a movement screen will be completed. Today, the therapist is using the functional range of motion profile, which looks solely at the ability to demonstrate function and does not focus on quality or pain with mobility.
All right, now I'm going to have you reach back, try to scratch that for a little bit. All right, the next one. Okay, I'm going to have you go across, elbow, very good. Next arm. All right, and have you give yourself a twist your torso as much as you can. Yep, good. Next. All right. All right. Put this deep belt right in front of you.
To maintain safety, a gait belt is applied as there will be balance activities in the next few sections of testing. In order to maintain efficiency and safety, a few other items are completed prior to finishing the functional range of motion profile, including a waist circumference, which helps factor in a patient's health risk, a Romberg test, which tests the patient's proprioception and function of the dorsal column of the spinal cord. This patient has a waist circumference of under 40 inches, which indicated no increased health risk.
All right, 96 centimeters. All right, can you step it forward a little bit more? All right.
The Romberg is completed by having the patient raise both arms, then tilt the head back, close the eyes, and maintain their balance despite perturbation from the therapist. A positive test would elicit a loss of balance, but as seen here, the patient demonstrates no difficulty with this task. A finger-to-nose test is also completed to screen for dysmetria, or impaired coordination. It is completed by having the patient bring their index finger to their nose while in standing and while keeping their eyes closed. The patient is able to touch their target easily each time, which demonstrates no impairment.
Close your eyes.
The patient's balance is then tested in single leg stance on the left, with the patient maintaining their balance well.
All right.
Therefore, the difficulty is increased by having the patient close their
Do you
eyes.
feel confident attempting a
When
single
moving
leg
to
on
the right
foot?
leg, the patient states discomfort with attempting a single leg stance on that leg, and thus a tandem stance is completed instead. Throughout these tests, the therapist remains close to the patient to ensure safety and provide balance assistance by using the gait belt if necessary.
All right, you can go relax. I'm going to have you go back and sit back down.
While the patient is sitting to rest, the therapist asks the patient for a recent height and weight measurement to add to the values collected for the health anthropometrics.
All right, for this, we're going to do.
While this
sit
patient
same
does
5
have an
times.
elevated
So you're gonna
BMI,
sit
this
up,
does
or
not
stand up,
align
sit
with the
back
patient's
down, make
athletic
sure it's
build.
all the way back
It is
down.
important to
Do that
remember
5
that
times
BMI
as
does
fast
not
as you can.
differentiate between fat mass and muscle mass.
Here we go. Make sure
Once
you
the
end
patient is
stand.
ready to begin movement again, a 5-time sit-to-stand test is completed. It is started with the patient sitting with their knees at 90 degrees, and the patient is instructed to stand 5 times in a row as fast as possible without using their hands. The therapist timer will start as the patient starts their first stand and will end as the patient sits after their 5th stand.
One more.
Any value over 12 seconds is indicative of an fall risk. Patient does have an elevated fall risk.
All right, have you stand up for me. First, I'm going to take a
At this point in
down,
time,
touch
the
your
functional
toes.
range of profile is completed, and the patient does exhibit
Now,
mild
spread your feet
limitations.
apart a little bit and give me a squat as deep as you can. That's as far as. Is that all? All right. Now I'm going to do a 10-meter walk test. I'm going to have you go over there to that.
Next, a 10-meter walk test is completed with the patient ambulating at a comfortable
For
pace.
this,
Ideally, the patient should be able to walk at a pace of 1 meter per second in order to demonstrate a safe gait speed within the community.
finish walking.
This patient's gait speed is lower than that and is therefore indicative of decreased safety with gait in the community.
gonna have you walk all the way back.
As the patient ambulates back to the table, the therapist is completing a gait observation where the consistency of the antalgic gait favoring the right leg is noted. The patient also demonstrates a decreased step length on the right, a decreased right knee flexion in swing phase, and a left lateral lean when clearing the right leg during swing phase. This also creates more of a foot flat approach than a straight gait.
All right, now I'm gonna take
Once the patient is back to the table, the belt is removed and the therapist instructs the patient to remove his shoes and socks.
Socks off.
The patient appears to have no difficulty with this task.
All right, now I'm gonna have you slump over.
Next, the therapist will instruct the patient to complete the slump test. Once the patient is in a slumped position with rounded shoulders, overpressure is applied first to the shoulders, then to the head and the neck, and then including passive range of motion of knee extension and ankle dorsiflexion. If symptoms are similar to the ones that the patient came into PT for are noted, the test is further confirmed by testing the release of either the foot or the neck to see if symptoms resolve. In this case, the patient demonstrates a negative slump test.
Good. And now I'm going to do it on the other side. Make sure you're slumped, flexed. Very good. Press down. Anything. Head. No. Get your foot. Like that. No. Okay. Alright, put your head up. Alright. Relax for me. Alright, now I'm gonna test your reflexes. Is the knee? Alright.
Next, the reflexes are tested using a reflex hammer. First, the patellar tendon and Achilles tendon on the non-affected side, and then only the Achilles tendon on the affected side, as the patient is only 2 days post-op. This patient demonstrates a reflex grade of 2+, which is considered normal. Next, the patient is asked to lie down and demonstrates no difficulty completing so independently. In this position, the therapist tests the patient's dermatomes via a light touch while using a cotton swab. The patient demonstrates a score of 2, which is normal, over the L4, L5, and S1 dermatomes. As these are the most distal portion, it is safe to assume that all dermatome levels above L4 are also intact.
Alright, very good. Now I'm going to do some myotome testing. I'm going to have your feet up. I'm going to press down on them, and you just try not to make me press them down.
Now the L4, L5, and S1 myotomes are tested via manual muscle testing of dorsiflexion, ankle eversion, and great toe extension. Patient demonstrates a normal response of 5 out of 5 strength for all, which also rules out any abnormalities of the myotomes above L4.
I'm going to do some movement here quick.
Next, the therapist tests the clonus reflex by quickly pulling the foot into dorsiflexion. In a positive response, the foot would beat and resist dorsiflexion until it fatigues out. In this case, the patient is negative, as there is no spasticity noted.
Very good.
Now the therapist tests the Babinski reflex by using the metal handle of the reflex hammer and quickly dragging it up the lateral aspect of the plantar surface of the foot and medially across the ball of the foot. This should result in a great toe flexion, as a congenital reflex of extension to this input is integrated early on in the lifespan. In this case, the patient is negative, as he does exhibit great toe flexion. Next, the therapist tests for nerve compression by using the straight leg raise test. This is performed via passive range of motion of dorsiflexion, knee extension, and hip flexion between 30 to 60 degrees. And cervical flexion. If the hip flexion angle surpasses 60 degrees, it is likely testing hamstring flexibility as opposed to the nerves. The patient is negative for this test, as it does not reproduce any symptoms of nerve pain such as numbness, burning, or tingling. Next, the therapist checks nail beds as well as pedal and radial pulses to ensure that the patient has good peripheral blood flow.
All right, very good. All right, I'm going to take a quick knee circumference first.
The therapist then moves on to taking a knee circumference measurement to help rule out the chance of a DVT, as this patient is post-total knee arthroplasty surgery. If there is a difference of 3 centimeters or greater between the legs, it is more likely that the patient may have a DVT. In this case, there is only a half a centimeter's difference, therefore this patient is at a low risk for a DVT.
About 42.5 on that side, very good. Now I'm going to do some go-knee measurements. First one's flexion. I'm going to have you bend your knee as far as you can.
Goniometric measurements are taken next, starting with knee flexion on the unaffected side and then on the affected side, and again with knee extension on the unaffected side and then on the affected side. Both are completed passively with overpressure to the patient's tolerance. The patient demonstrates decreased knee flexion on the affected leg as compared to the unaffected leg, but knee extension bilaterally appears similar.
That's going about 103 on that side. Okay. Bring that down. I'm going to put this under your feet. This one first. I'm going to press down on your knee here in a second. All right, that's about -7. Now on this side. Alright, I'm going to have you sit on back on that side of the bed for me. Alright, we're going to take some knee strength measurements. Okay. I'm going to
In order to gain better insight to the patient's current level of strength and comfort with movement of the lower extremity through the sagittal plane, force measurements of the knee extension is taken via the use of a handheld dynamometer. The patient is noted to have significantly decreased peak force production on the affected leg as opposed to the unaffected leg. To complete this test, the therapist holds the dynamometer 2 centimeters above the medial malleolus while keeping the patient's knee at 90 degrees of knee flexion. The therapist must brace himself by holding onto the table frame and keeping his arm parallel to the floor. The patient must keep his hands in his lap. This test takes 5 seconds to complete, with the patient instructed to slowly ramp up their force within the first 2 seconds and sustain their full force by the remainder of the time. The therapist will maintain a make technique, which uses an isometric force.
Push. Very good. And stop. Nice. All right, I'm going to thank you for coming in today. Do you have any questions?
I don't think so, no.
All right, I'll walk you to the front desk where they can schedule you.
We have reached the conclusion of this evaluation. The therapist thanks the patient for his time and offers an opportunity for questions before helping the patient towards the front desk for scheduling.
Have a good one. Okay. Now I'm gonna run. All right.
haven't started yet.
Okay. Ready? Yeah. Alright. Now I'm gonna.
Yeah.
Alright. Now I'm gonna.
Shit. You're gonna take a lap.
Ready?
Yeah.
I was gonna say already in, but okay. Now I'm gonna rock you through.
Rock me. Fuck. I got Michael again. We're trying to do our video. We're not gonna get fucking past. Can we like skip the movement screen and go to something else?
And come back. We
Come
can.
back. I don't care.
Okay.
Well, you have to
As long as you can like somewhat maintain
Alright,
a
let's just go for it.
somewhat maintain a straight face. I can always just cut out the laughter.
You narrate through.
Yes,
this part,
exactly.
Okay. If you're laughing, look that way.
Okay.
All right.
I'm just gonna smile.
Now look down. Look over your shoulder. Now. All right. Now I'm gonna have your head. Put your head up. Now look down. Look over your shoulder. No. Ready? Yep. You have a seat right there.
Come on.
Go ahead, just keep going.
Your reflexes.
Okay.
I was like, I gotta do it from this side. I can't do it backhanded.
Alright, restart.